10. Leprosy, the Middle Ages. Leprosy, aka Hansen's disease, is a slow-developing bacterial disease that can lead to damage of the nerves, skin, eyes, and respiratory tract. Those infected by the disease may experience poor eyesight and muscle weakness. Some patients can no longer feel pain, which may result in the partial loss of extremities. The disease has affected humans for thousands of years, but it became a pandemic in Europe during the Middle Ages. As they were deemed to be unclean, infected individuals had to wear certain clothing or a bell to signal their arrival. However, they were forbidden to go to many locations. It is believed that around 19,000 leper houses existed in Europe during this time. 1. Called the living dead, lepers were linked to sin and declared legally dead by civic leaders who confiscated the belongings of the sick. There are still around 200,000 cases of leprosy a year, but it can now be cured with medication. However, some patients need ongoing treatment for complications like blindness and paralysis. 9. Russian flu. The Russian flu, aka Asiatic flu, was a deadly influenza pandemic that killed approximately 1 million people around the globe. The outbreak started spreading in 1889 and was the largest 19th-century epidemic of influenza. It was also the first true epidemic that happened in the era of bacteriology. The initial cases were reported in Bokhara in Central Asia, Turkestan, Athabasca in northwestern Canada, and Greenland. Within 6 months, the disease had infected St. Petersburg, Russia. Only 4 months later, the influenza had spread throughout the northern hemisphere. Rapid population growth in urban areas across the globe helped to create a pandemic. 8. Antonine Plague. One of the deadliest pandemics in history is also one of the oldest. The Antonine Plague occurred in 165–180 and ultimately took the lives of about 5 million people. The Romans brought the disease back home with them after a war with the Parthians. The disease started in Asia Minor and then spread to Greece and Italy. For the next 2 decades, the Roman Empire saw an outbreak unlike anything they had ever experienced. At the peak of the spread, they were seeing about 2,000 fatalities per day. It was estimated that 7–10% of the entire Roman Empire was killed, with higher percentages in denser areas. The empire's core rulers Marcus Aurelius and Lucius Verus both died during this time period. Many have speculated that they were killed by this disease. Although the ailment that attacked these people is unknown, many scholars believe it was an outbreak of smallpox. 7. Asian flu. In the 20th century, the second major influenza pandemic was the Asian flu of 1957, aka the Asian flu pandemic. The outbreak was responsible for more than 1 million deaths. At the beginning of the Asian flu pandemic, the virus spread throughout China and the surrounding regions. Months later, the flu had reached the United States and was widespread in the United Kingdom. Just 3 months into 1958, the United States had estimated that nearly 70,000 deaths were linked to the Asian flu. A vaccine was eventually developed that helped contain the pandemic. 6. Spanish flu. The Spanish flu, also known as the 1918 flu pandemic, was an unusually deadly influenza pandemic. Lasting almost 36 months from January 1918 to December 1920, it infected 500 million people, about a third of the world's population at the time. The death toll is estimated to have been anywhere from 17 million to 50 million, and possibly as high as 100 million, making it one of the deadliest pandemics in human history. 5. Cholera. Cholera is an infection of the small intestine by some strains of the bacterium Vibrio cholerae. Symptoms may range from none, to mild, to severe. The classic symptom is large amounts of watery diarrhea that lasts a few days. Vomiting and muscle cramps may also occur. Diarrhea can be so severe that it leads within hours to severe dehydration and electrolyte imbalance. This may result in sunken eyes, cold skin, decreased skin elasticity, and wrinkling of the hands and feet. Dehydration can cause the skin to turn bluish. Symptoms start 2 hours to 5 days after exposure. Cholera affects an estimated 3.5 million people worldwide and causes 28,801,30,000 deaths a year. Although it is classified as a pandemic as of 2010, it is rare in the developed world. Children are mostly affected. 4. Smallpox. Smallpox was an infectious disease caused by one of two virus variants, Variola major and Variola minor. The last naturally occurring case was diagnosed in October 1977, and the World Health Organization, WHO, certified the global eradication of the disease in 1980. The risk of death following contracting the disease was about 30%, with higher rates among babies. Often those who survived had extensive scarring of their skin, and some were left blind. The initial symptoms of the disease included fever and vomiting. This was followed by formation of sores in the mouth and a skin rash. Over a number of days the skin rash turned into characteristic fluid-filled bumps with a dent in the center. The bumps then scabbed over and fell off, leaving scars. The disease was spread between people or via contaminated objects. Prevention was by the smallpox vaccine. Once the disease had developed, certain antiviral medication may have helped. The origin of smallpox is unknown. The earliest evidence of the disease dates to the 3rd century BCE in Egyptian mummies. The disease historically occurred in outbreaks. In 18th century Europe, it is estimated 400,000 people per year died from the disease, and 1/3 of the cases resulted in blindness. These deaths included 6 monarchs. Smallpox is estimated to have killed up to 300 million people in the 20th century and around 500 million people in the last 100 years of its existence. As recently as 1967, 15 million cases occurred a year. 3. The Great Plague of London. During the Great Plague of London, 1665 to 1666, the disease called the bubonic plague killed about 200,000 people in London, England. In 7 months, almost 1/4 of London's population, 1 out of every 4 Londoners, died from the plague. At its worst, in September of 1665, the plague killed 7,165 people in 1 week. After this, the number of people dying from the plague began to slow down. Around September of 1666, the Great Outbreak ended. The Great Fire of London, which happened on February 6, September 1666, may have helped end the outbreak by killing many of the rats and fleas who were spreading the plague. 2. Black Death. The Black Death, also known as the pestilence and the plague, was the most fatal pandemic recorded in human history, resulting in the deaths of up to 75-200 million people in Eurasia and North Africa, peaking in Europe from 1347 to 1351. Plague, the disease caused by the bacterium Yersinia pestis, is believed to have been the cause. Y. pestis infection can cause septicemic and pneumonic plagues but most commonly results in bubonic plague. The Black Death was the second plague pandemic recorded, after the Plague of Justinian, 542-546. The plague created religious, social, and economic upheavals, with profound effects on the course of European history. The Black Death most likely originated in Central Asia or East Asia, from where it traveled along the Silk Road, reaching Crimea by 1347. From there, it was most likely carried by fleas living on the black rats that traveled on Genoese merchant ships, spreading throughout the Mediterranean basin and reaching Africa, Western Asia, and the rest of Europe via Constantinople, Sicily, and the Italian peninsula. The Black Death was the second disaster affecting Europe during the late Middle Ages, the first one being the Great Famine, and is estimated to have killed 30% to 60% of Europe's population. In total, the plague may have reduced the world population from an estimated 475 million to 353-375 million in the 14th century. It took 200 years for Europe's population to recover to its previous level. Outbreaks of the plague recurred at various locations around the world until the early 20th century. 1. Plague of Justinian. The Plague of Justinian, 541–542 AD, with recurrences until 750, was a pandemic that afflicted the Byzantine, Eastern Roman, Empire and especially its capital, Constantinople, as well as the Sasanian Empire and port cities around the entire Mediterranean Sea, as merchant ships harbored rats that carried fleas infected with plague. Some historians believe the Plague of Justinian was one of the deadliest pandemics in history, resulting in the deaths of an estimated 25–100 million people during 2 centuries of recurrence, a death toll equivalent to as much as half of Europe's population at the time of the first outbreak. The plague's social and cultural impact has been compared to that of the Black Death that devastated Eurasia in the 14th century, but research published in 2019 argued that the plague's death toll and social effects have been exaggerated.